Back in 1990, the story of Kimberly Bergala stunned the nation. She was the first of 6 Florida dental patients who said that their dentist had infected them with the AIDS virus. The dentist died of AIDS. Kimberly died, as have 2 of the other patients. All of the patients, claiming they couldn't have gotten AIDS any other way, sued the dentist, his estate, and his insurance companies. And they've collected so far an estimated $10 million in out-of-court settlements. The case made a lot of us worry about going to our own dentists, and it made us wonder about how it could happen. Concerns like these helped launch a national campaign to test all healthcare workers for AIDS, with Kimberly Bergalis making an emotional plea before Congress.
I did nothing wrong, yet I'm being made to suffer like this. My life has been taken away. Please enact legislation so that no other patient or health care provider will have to go through the hell that I have.
At that time, I was the chief professional advisor for the largest dental and medical catalog supply company in the world, Henry Schein, Inc. Early in my career, I published books and tapes using my knowledge of the behavioral sciences, including the Overcoming Your Fear of the Dentist program, and for this company, Dentistry in the Age of AIDS. By then, I had published dozens of scientific articles. Because of this case and my background, the company sent me on a lecture circuit between 1990 and 93, when I personally trained nearly 30,000 healthcare professionals in the psychology and clinical practices of infection control. But the government and my employer did not like my research. The controversy I created by publishing reports that conflicted with what officials were saying, based on my use of the FBI's official methods and materials, resulted in my corporate dismissal and blacklisting from lecture circuits of all dental and medical associations. Because of this, you might think I have an axe to grind, or that I'm biased against the government. Some people, especially health officials, dismiss my credibility because I began my career as a dentist, even though I received advanced degrees, one from Harvard University in public health, behavioral science, and 2 more doctorates since then. In short, I have been character assassinated sufficiently to say it is easy to assassinate a messenger. It is a lot harder for intelligent people to dismiss an honest, well-documented message.
One of the many top-dog researchers who is in Vancouver for the International Conference on AIDS. He is Harvard educated. He has a doctorate in dental medicine from Tufts University in Massachusetts. He's an international authority in public health education, and he's also a prolific author. When Dr. Horowitz first heard the theory that the AIDS virus and other killer germs were deliberately cultured as biological weapons and deliberately targeted at unsuspecting victims, he thought the mere idea mad, some wild conspiracy perhaps, or at least good grist for a sci-fi novel. Somewhere along the way, he's changed his mind. He's presenting his investigations at the AIDS conference in Vancouver on Wednesday, and Dr. Horowitz joins us in our studio. When did you go from thinking this was a mad idea to a possibility?
It took me about 8 months having a document sit on my desk, which was a 1970 appropriations request for $10 million for the development of AIDS-like viruses. And it sat on my desk, and I realized, I read it, it said the National Academy of Sciences National Research Council informed the Department of Defense that they could develop synthetic biological agents for germ warfare in 1970 over 5 years for the cost of $10 million. And that led me in to investigate whether that document was accurate, whether it was real, and then I began to investigate what happened to the money. And that's what ended up in me looking and finding the origin of AIDS and Ebola.
What do you believe about the origin of AIDS?
What I know, and what I'm presenting on Wednesday, is that it's a man-made virus. There's no question in my mind these viruses are man-made biological weapons, if you will, or they were developed for cancer research models by National Cancer Institute researchers, people under National Cancer Institute contract, who also were contractors for the Department of Defense. So I know that they were man-made. The question that I leave the readers of my book, Emerging Viruses, and when I'm going to be sharing the information on Wednesday, is that I leave it to you to figure out whether it was an accident, whether these viruses got out accidentally, or whether they were intentionally deployed, as some people would have us believe, or some of the evidence shows.